5000マーク円号はまもなく元の船着き場へと到着いたします。恐れ入りますが、2階デッキ、3階デッキでお楽しみの皆様、1階デッキにお降りになりまして、下船の準備をお願いいたします。
আমরা ইউএস মেরিন শিপে 15 মিনিটে ভ্রমণ করলাম। সুন্দর শিপ জার্নি।
それではこの後も夢と魔法の王国東京ディズニーランドで素敵なひとときをお過ごしください。本日はご乗船いただきまして
shape, and when we use optical magnification, which is up to 125, we can see the distinctive abnormal IPCL. And this is probably type 5.2, which means it's invasion of the mucosa, and this is amenable to endoscopy resection. And down here, what you can see is the normal IPCL. So this patient actually underwent endoscopic resection successfully. So coppers wear the round pits. And you realize that if we use similar imaging with narrowband imaging, the appearance is actually quite similar. This is with optical magnification. It's not like in the case of the live demo earlier, where digital magnification and near focus was used. And therefore, with optical magnification, much clearer details, especially the vascular structure can be seen more clearly. So in the case of early gastric cancer, what we use for recognition and diagnosis would be the MV pattern, meaning to say a microvascular pattern, microsurface pattern with a presence of a demarcation line, which I think most of you are quite familiar with. So if you look at this image of early gastric cancer, on one side you have BLI, on the other side you have narrowband imaging. You can see in both instances a clear demarcation line between cancerous and non-cancerous area can be seen. And within the lesion itself, you can see clearly the image of intestinal metaplasia with the light blue crest. And then lower down you can see again early gastric cancer characterized by the demarcation line and abnormal. Some published studies that look at specifically in the case of colonic polyp, the utility of BLI specifically to help us to make a diagnosis of the nature of the polyp. So in this instance, they use the Hiroshima classification for colonic polyp, but ultimately the principle is the same as mine, using both the microsurface pattern and also microvascular pattern. And by recognizing the different
pancreatogram with a small stone, duct is essentially fine. You go and take out the stone and the patient settles down beautifully. So I feel that if a small stone which was picked up, as you must have noticed, we do not inject contrast initially. I always go in the pancreatic duct without contrast because I have a fantastic pancreatogram on EUS. So I just take the guide wire, go interleave in the pancreatic duct and clear the stone and then leave the stent in. I'm going to skip this slide, but I'm going to show you this particular slide. This is a very, very interesting case. Patient with multiple stones in the pancreatic duct, calcification, but patient had severe pain and very, very active. So similar thing we did, there was some amount of parenchymal calcification. Now these are the patients who will have interim relief before they go for surgery. So sometimes very inflamed head, a surgeon, this has happened with me, that we said difficulty RCP and surgeon wanted to go in and everything was plastered. So endotherapy could be a bridge to intervention in such situation. Now, you also have to keep an eye on patients with obstructive jaundice in a setting of chronic pancreatitis. You can see a large stone here, and you can see the dilated CBD with a stricture. This is a malignant lesion in the setting of chronic pancreatitis. So any patient who has jaundice in chronic pancreatitis, you have to chase this patient. Make sure that there is no tumor. Unless and until now, I'm sure Laurent, we're going to talk about elastography and contra-enhanced EUS, but back in those 2010, we didn't have, but we found this irregular lesion. FNA, this patient was referred to me for endotherapy. I said, no, this patient needs a resection, a young patient of 28. So we did EUS FNA, proved it was adenocarcinoma. Now, what's the role of EUS in pancreas divisum? I'm sure Laurent will also agree that I presented in way back in 1999 in DBW. You can see this short stack sign. You can see the pancreatic duct coming down, endosonography, color Doppler. And we picked up some abnormal vascular activity. And then we realized that since CT is not showing anything, this is a frank bleeding ampulla. So all we had to do was cannulate the pancreatic duct, and the moment we remove the stone, that the stone has eroded into the ductal epithelium, and that's where he was bleeding from.
और ছেলে বলছে ভিডিও করে নিয়ে আসবা সি বিচের নাম কি মলেশ What is the name?
Worli Sea Face.
Huh?
Worli Sea Face.
Worli Sea Beach.
Sea Face.
Sea Pace. Worli Sea Pace.
এই ব্রিজটা নতুন হয়েছে ये নতুন নয়া আমরা কিন্তু ব্রিজের উপর দিয়ে যাইতেছি এই যে সামনের দিকে
ছবিটা ভালো আসতেছে না This is Hotel Taj, where miscreants bombs. কতজন মারা গেছিল? About 10 people died.
না ওরা প্রায় 30
একদম অন্ধকার কিছু দেখা যায়
हेलो वो शर्ट का तुमने इतना फजीता करा वाला करते 50 वाट
চলেন জায়গা একটু ভিডিও করে নিই এটা এলাকার নাম কি এটার নাম কি জহুর হ্যাঁ
নতুন করে